I wanted to pop in and I wanted to talk about something that is a huge struggle for so many people, and that is eating with dentures. I belong to several support groups for denture wearers on Facebook, and one of the common things that come up is I tried to eat this and I couldn't. For example, a corn dog. I tried to eat a corn dog. I'm 9 days out with my new dentures and I couldn't eat the corn dog. This is impossible. I quit. I'm just not going to wear my dentures when I eat. So early into the journey, and not just days, but it could be weeks or even a couple of months into this journey, you may struggle with certain foods. That doesn't mean that you will never be able to eat those foods. It means that today you cannot eat those foods. So, for example, a corn dog. You're a few days out, a couple weeks out, maybe a couple months out, and you're not using adhesive. You bite into the corn dog. Your dentures are kind of moving all over the place. You don't know what you're supposed to do. You get super frustrated with that corn dog. You are just done. You know you can't eat with these horrible things, and you're over it. You're just over it. This journey is not a do and succeed journey. It is a try and fail and try and fail and try and fail, try and succeed journey. And maybe not that simple. It might not be try and fail 3 times. It might be try and fail, try and fail, try and fail. If you fail today, try again later on down the road. If you fail then, try again, try again, try again. The thing with prosthetic teeth is we are not given physical therapy. And I talk about this often in my videos. We are not given physical therapy. If we had a prosthetic limb, a prosthetic leg, for example, we would get physical therapy. They would teach us how to use our prosthetic limb. We do not get that as denture wearers. Nobody says, well, this is a really challenging journey. You need to learn how to use your prosthetic teeth. We're going to teach you. Not too many. No, I don't think anybody does it. It's really a, here's your new dentures. Bye. Good luck. And that's it. And that's pretty much it. We just get to figure it out on our own. So we have to give ourselves our own physical therapy on this journey, which means setting goals, just as you would if you had a prosthetic limb. If you had a prosthetic leg, you would not expect on day 1 to put your prosthetic leg on and just start walking across the room like you did before your leg was amputated. You would not expect to do that. You would understand that it would be literal baby steps. Every day you would have goals, succeed in, or try and fail, try and fail, try and fail, try and fail, and try and succeed. Sometimes you might try and succeed right off the bat, but a lot of times you're going to try and fail, try and fail, try and fail, try and fail, and then one day you're going to succeed, and then you set a new goal. If you had a prosthetic limb, you have prosthetic teeth, and that is exactly what people on this journey need to do. We need to set goals with eating. I can't eat this now. That's okay. If you can't eat this now, the normal way, cut it up. Don't give up on that corn dog. Just cut it up. Cut it into slices and cut those slices into quarters. Eat the corn dog. Maybe not eat the corn dog, more like eat the corn dog like that, but you're still eating it. And then gradually you'll get there, and you will get there, but you have to keep trying and trying and trying. And on those days that you do not succeed, remember, you are doing your best. You do not know how to do this. The one thing that I say, and this is probably not going to make sense to a lot of people, but we don't know what we don't know until we realize we didn't know it. And that is how it is with prosthetic teeth. We don't know what the heck we're doing. We have to figure it out. We don't know it until we know we didn't know it, and then we learn it. I know it probably sounds like a really twisted riddle, but that's what I tell my grandchildren all the time, because they just want to know stuff. And we don't just know things, and we don't know how to use prosthetic teeth just on day 1 when we put them in our mouths. There's a lot of things that we have to learn. Set goals, try. If you fail, try again, try again, try again. A lot of times people will tell a person struggling with eating, their solution will be just take your teeth out, gum it, just eat it that way. And on the surface, that seems like a really good solution. Just take your dentures out and eat. But my thing with that is, how are you going to learn how to use your prosthetic teeth if you are consistently taking them out to eat because it's easier? Is it easier? I don't know, because I've never eaten without my dentures, not one time in 18 years. Healing dentures to permanent dentures, had that pair of dentures, not to be confused with implant dentures, just that second set of dentures you get after your healing dentures. Had that pair for 14 years, had these for 4 years. I have never, not one time, eaten without my dentures in. So I don't know if it's easier. I've never done it. But a lot of people say it is easier. But if you get into the habit of eating without your dentures in, you're never going to learn how to use them. I've said it also in multiple videos. If your dentures are causing you extreme pain, they are digging in spots and causing sores, obviously you need to take them out. You need to have your dentist adjust those things, and you need to get that fixed. But if your dentures are not causing you pain, they are not digging in, they are just a challenge. They are going to be a challenge, just as if you had a prosthetic limb. These are prosthetic teeth. I know we have a lot of really cute words for them, false teeth and, not cute, but false teeth, dentures, fake teeth. We have all these names for it, and they just kind of minimize what they are. Prosthetic teeth. That's what they are. We wouldn't just nonchalantly say a fake limb, or just like it's no big deal. It'd be like, yeah, you got a prosthetic leg. That's a huge deal. Prosthetic teeth, also huge deal. So we need to set goals. Might not reach them like right away, but the more you push through, you'll get there. With eating, with talking, with smiling, with getting used to the new you in the mirror. When I switched to these dentures 4 years ago, my dentist told me, you are going to hate them. Your face has changed. It did. Your teeth look different. They did. And you are going to be super tempted to put your old dentures in because it's just easier. And it probably would have been easier. I don't know. I didn't do it. I did what my dentist said. I kept these in. I did not take them out. I did not swap them out because it was easier. I pushed through. And that's what we need to do on this journey. We need to push through. Baby steps. And we need to be kind and patient and understanding with ourselves, because we are learning to use prosthetic teeth. And it is challenging. There are good days, there are bad days, and for some people there are a lot more bad days than there are good days at the beginning. But the more you push through it, the more you go through all of those trials and tribulations, there will be successes at some point. We can't just quit because it's hard. It's easy to quit, but it's not going to solve anything. So we need to push through. So if you are struggling today, just remember, set goals. If today was a hard day, that's okay. Take your dentures out, go sit down, have a bowl of ice cream. I've heard that ice cream tastes really good when your dentures are out. Have a bowl of ice cream, sit down, chill, relax, and try again tomorrow. That's the only advice that I really have, is just keep trying. I feel like quoting Dory, just keep swimming, just keep swimming. You'll get there. I promise. You will get there, but you have to get through the hard parts. Doing things because it's easier isn't going to help at all. So I'm going to go ahead and go. I just don't know who needed to hear this, but I wanted to throw this out into the universe because I know that it can be such a hard struggle. Set goals with eating, with saying words, read things out loud, sing songs out loud, nursery rhymes. Set aside an amount of time every day. Give yourself physical therapy, and it'll help. I promise. I'm going to go ahead and go. I'll talk to you later. Bye.